Obese and over 65. When diet and exercise fail, there is hope. The latest research from Dallas surgeons show patients over 65 can tolerate and benefit from weight loss surgery. Dr. Joseph Kuhn is here from Medical City to talk to us. He also brought one of his patients who's a big fan of this procedure, John Brever. John, thank you so much for being here.
Thank you.
Tell me, we're going to start with John and then we'll go into some of the details with you. John, what was going on in your life that made you decide it was time to go ahead and have this surgery?
Well, I was so heavy and I kept gaining a couple of pounds because I couldn't do anything. And I couldn't walk across the room without stopping. And I decided I had to use a scooter to go to the store. I had to use a scooter to go to the show. And I decided I needed, and I was depressed. So I said, I got to get some help. I really needed some help. And I talked to my doctors about getting this done, and then I went to Dr. Kuhn's seminar.
Right.
And from there, it has been uphill.
Well, tell me how your life has changed since that time, because you, just talking to him beforehand, he's one of the biggest fans in terms of the difference it's made in your life.
Well, I can walk 2 miles a day. I work in the backyard again. I'm doing things I haven't done in 25 years.
And you said the scooter's in the garage.
And the scooter's in the garage? Yes.
And you had this procedure over a year ago. It was May of last year. And you've kept the weight off.
Yes. And I'm down, I'm 95 pounds right now, and I'm still
You've lost 95 pounds and still losing.
Yes.
All right, well, Dr. Kuhn, I want you to tell us about the specific procedure he had, but first, talk about the research that you guys presented just last week. It was at the National Bariatric Meeting last month. I wanted to get that right. What were the findings?
Well, it was actually the world's largest experience in patients over the age of 65 who had a gastric bypass. And what we found is that they did equally as well as patients who are under the age of 65 in terms of the correction of not only their weight, they lost about 80% of their excess weight, and more importantly, they lost a lot of their comorbid conditions, meaning the diabetes went away about 70% of the time, blood pressure went away about 50 to 60% of the time, and the complications were equal to the younger population. So it was an outstanding result that showed that weight loss surgery really should be considered in the treatment of some patients with morbid obesity with some of these other problems.
Now, that's one of the things I wanted to talk to you about, because this is a serious medical condition. A lot of people, when they think about weight loss surgery, they think of it in terms of cosmetics, but these are really serious health issues that are affecting our country right now. Obesity, among diabetes. What do these findings show us in terms of what it can do for our older population?
Well, again, we have to get out of the idea of thinking that mom or dad are too old to consider this. When we think about a lot of operations we do in patients who are 70 or 80, replacing a hip or taking out a lung, these are sometimes big operations that have kind of minimal benefit. But nowadays, with a laparoscopic procedure that typically takes about an hour, patients usually go home the next day, here we're able to correct diabetes, hypertension, sleep apnea, reflux. So it's a great operation that each patient, each doctor needs to consider, and age shouldn't really be a major consideration right now.
Well, and you would echo that your quality of life is skyrocketed.
It has.
All right.
I'm so much happier.
That's the testimony right there. What more do you need to hear? Well, I know you also have an event coming up where you're trying to raise awareness about this obesity. Tell me what the walk is.
Well, the walk is a nationally organized walk. It's across the country, and it's this month, it's in September 26th. It's organized by the Cooper Clinic, Medical City, and most bariatric programs in the city. The idea is that we shouldn't just focus on cancer, heart disease, diabetes. Obesity, just as you said, is one of the major problems facing America. And this walk promotes not just awareness, but research, funding, advocacy. It's not just surgery either, it's medical treatment.